Thank you. Good afternoon. I'm Dr. Nivedita Mohan, and today my paper is titled Prevalence of Hepatitis C Among Patients Undergoing Maintenance Hemodialysis at a Tertiary Care Center. Hepatitis C virus was discovered in 1989, and since then it has been a major health concern worldwide. It infects the liver, leading to chronic hepatitis, which can later progress to liver cirrhosis and hepatocellular carcinoma. Prolonged vascular exposure and frequent blood transfusions increases the risk of acquiring hepatitis C viral infection in patients on hemodialysis. With the advent of direct-acting antivirals, hepatitis C viral treatment has advanced substantially in the last decade. Hence, it is vital to understand the disease prevalence and transmission dynamics in key populations like those patients on hemodialysis. The aim of the study was to estimate the prevalence of hepatitis C among patients undergoing maintenance hemodialysis and to correlate the HCV positivity with their clinical presentation. The patients on maintenance hemodialysis from February to July 2020 were enrolled into this prospective study. The inclusion criteria involved patients greater than 18 years of age and who have undergone at least 15 sessions of hemodialysis. Exclusion criteria included patients diagnosed with HCV prior to hemodialysis. This is a flowchart showing the methodology. 150 patients were enrolled into the study. Serum and plasma samples were collected from all these patients. And out of this, serum samples of all 150 patients were subjected to HCV IgG antibody ELISA. Out of all these 150 patients, 28 turned positive for antibodies and 22 were negative for antibodies. Of these positive, the 28 positive, plasma samples of these patients were subjected to qRT-PCR for detection of HCV viral load. Out of this, 21 were positive and 7 were negative. The results show that among 150 patients on dialysis, there were 108 men, that is 72% were men, and 42 were women, which is 28%. If we look at the gender in each HCV positive and HCV negative, we see the percentage is similar where there is a male preponderance. Among the 150 patients on dialysis, the mean age was 44.29 years. This table shows the mean and standard deviation for HCV positive and negative patients. Among positive patients, it is 43.82 years and standard deviation was 10.57. In HCV negative patients, it was 44.77 years and standard deviation was 10.60. Out of this 150 samples, 28 were positive for HCV IgG antibody ELISA. And out of these 28, 21 were positive by qRT-PCR for the detection of HCV virus. Hence, the hepatitis C was detected in 14% of patients. That is 21 out of 150. This graph shows if there was a previous history of blood transfusion in the patients. In the graph, it's divided into HCV positive and negative patients. Totally, there were 21 HCV positive patients and 129 HCV negative patients. Out of this, 19 of 21 HCV positive patients gave a previous history of blood transfusions. There was higher rates of blood transfusions in HCV positive group, that is 90.4%, than the HCV negative group, which was 69.7%. But both the groups had high rates of blood transfusion history. This table shows the duration of dialysis in years. So the duration of dialysis in patients on hemodialysis was found to be higher for HCV positive patients. In HCV positive patients, the mean years was 3.87 with a standard deviation of 1.87, and in HCV negative, it was 2.42 years with a standard deviation of 1.60. The discussion for this paper, in this study, 72% of HCV positives were males and the average age of the infected patients were 44.29 years. This was concordant with the findings of Madhavan et al., who reported that majority of the HCV positives were males, with an average age of 58.25 and standard deviation of 16.35 years. It is well known that hemodialysis patients are at a high risk of development of HCV infection. In the present study, which was conducted in Hyderabad, the prevalence was 14%. In a study by Madhavan et al. In 2020 in Kerala, the prevalence was 8%. A study by Subramanian et al. In 2016 in Gujarat, the prevalence was 2.4%. Kansey et al. In 2019 from Punjab showed a prevalence of 15.3%. Indian studies have shown HCV prevalence among hemodialysis patients varying from 2.4% to 15.3%. The mean and standard deviation of years of dialysis was higher in the HCV positive group as compared to the HCV negative group. This emphasizes that the longer duration of dialysis was a risk factor for acquiring hepatitis C viral infection. Studies like Saab S et al. And Dentico P et al. Have also shown that a previous history of blood transfusion increases the risk of acquiring HCV infection. The current study also shows a higher rate of blood transfusions among the HCV positive group. In conclusion, the prevalence of hepatitis C among patients undergoing maintenance hemodialysis was found to be 14% in the study. The previous history of blood transfusions and duration of dialysis were the main risk factors for acquiring the infection. A strict adherence to infection control strategies and adequate screening of blood products are recommended to prevent nosocomial transmission of infections. These are my references. Thank you.